agenda. But what many people don't realize is how devastated the healthcare industry was by COVID. Here in Massachusetts, but everywhere. But the whole healthcare industry is a mess. The pricing is insane. If anybody's been in the hospital and you get these EOBs, the industries behind it and the concentration of that, you talked about that in other industries, but what's going on in healthcare is a travesty, I think. When I went to medical school in the mid-70s, very few physicians made seven-figure incomes. That wasn't even heard of. Now there's lots of dermatologists, ophthalmologists, all of these people who make tons of money, and we're losing primary care physicians. No one in their right mind would want to become a primary care physician right now. So that's throwing you a softball. You might not be able to answer it all in a short answer, but I wonder what you're thinking. I don't think Medicare for all is a very sophisticated way to solve it. Medicare is a mess. So we need to fix all these things. And I'm not sure if there's any hope to do it.
Okay, so that was a hopeful question. And you know, I can do this one in 120 seconds. Not really. Let me start there. I want to start with structure. We have so many structural problems right now in healthcare, but one of the central ones is vertical integration. And can I go back to my old friend private equity, who is buying up healthcare practices all over Massachusetts and all around the country. And doctors are suddenly discovering that they have to work in 7-minute billing increments, regardless of what's wrong or how much time they actually need with the patient. Private equity has also figured out that learning, for example, on Medicare, you all who've gone in for Medicare Advantage, and I understand the reasons for Medicare Advantage, but the guys who run it, these so-called insurance folks, they figured out about upcoding. And they actually pay house calls on people who have Medicare Advantage to listen to them describe, oh yeah, sometimes my ankle hurts, put down bone and joint deterioration, falling down terrible problem, and to upcode all the things that are wrong so you look sicker. It's not because they're going to give you more care, it's because they're going to get paid more from the federal government. I mentioned the prescription drugs. Those drugs cost about, we are paying about 3.5 times more than other countries are paying. And let's just be blunt, we're the people who paid for the research at the National Institutes of Health and much of our other support for science, which I'm glad we did, and I want to keep right on doing. We pay for the research to develop the drugs and then end up paying more, our consumers do, and our healthcare system ends up paying more to be able to deliver those drugs. How many we could just keep going on and on with problems. But here's how I see this. We're going to have to start peeling these pieces apart. Pharmacy benefit managers, for example, this is part of the vertical integration. It's technical, it's hard, it's easy for the industry and the people they lobby to demagogue what's happening. Did you all see in 2022 when we were able to cut some of the expenses on what Medicare had to pay for some things, that there were Republicans who ran ads who said, Democrats are cutting your Medicare. They cut your Medicare by $22 million last year. No, we cut what we pay private industry in profits. So I say all this by way of saying it's technically a series of hard problems. It's not one hard problem. There is no magic bullet here. It's a series of hard problems technically, and it is a series of hard problems politically. So we have 3 choices. One is we can just do what the industry does until there's nothing left. We spend 100% of our GDP on healthcare and get lousy results. That's one path. And frankly, I think that's pretty much the Republican view on this right now, and some Democrats. The second is we take a bite here and a bite there. $35 insulin. It's a bite, and it's a good bite. but it's just a bottle. I mean, it's insulin, and I'm really, really glad for everybody who uses insulin, but it's not helping people who need blood thinners, right? We're moving, but we're moving really, really slow. The third is to say we're going to take on some of the structures, and we're just going to shake them, and there are going to be people who are going to hate this, and there are rich people who hate it. I mean, rich meaning corporate CEOs, giant corporations. These drug companies now, do you know that there's actually a technical term of art, it's just called a blockbuster drug. And blockbuster means $1 billion a year or more in profits on a single drug. And we have multiple drug companies here in the United States who have multiple blockbuster drugs. And they want to protect that. They're actually suing the government right now over the Medicare drug negotiations, saying they have a right to name their own price and nobody on the other side gets to negotiate it. I didn't read that part of the Constitution, but I'm ready to hear the argument. So all of that is by way of saying, thank you for your many years in healthcare. Thank you for reminding us that it used to be different and that we have to do a whole lot better job than we have right now. But I really have to say this, it's going to take a lot of political will to keep our Secretary of Health and Human Services, I'm not talking about the particular, but I'm just saying whoever is in that job, the head of Medicare and Medicaid, to keep a president of the United States willing to take on the kind of political firestorm that it's going to take to fix prescription drug pricing, to fix hospital pricing and access, to fix access to physician care, and to fix the non-medical care, the seniors, people who need help, but not as extensive as hospital. These are huge. And we just have to do it. And I get it. We're not making very much progress, but I do want to say this. I want to underscore it again. We are making some progress. And some progress is better than no progress. And if we give lots of reward to the president who led us on this prospect, and to the people in Congress who led on this, that's how we get more change. So that's